Here's a direct question from someone. Why didn't you become a doctor, Caspar?
I love it. I love it. This is something I get so much. And random people just write me like really in-depth things about their medical condition. And I just have to respond, I'm not a doctor, right? Like, that's my father, Dr. Szulc. I am just Caspar Szulc, not a doctor. Listen, I get it. I think in medicine, a lot of people just assume if you're in medicine, you're a doctor, or at least a healthcare practitioner. I didn't become a doctor really for this reason. I saw my father very little growing up in some ways. Like, he wasn't at T-ball games and everything. He was really, really trying to push his career forward. And he spent long hours at the hospital and did everything. And I was just like, you know what? When I grow up, I want to be more present, and just be. Little did I know, being an entrepreneur, I'd probably work harder than my father. I mean, I don't have kids yet, probably because of that too, because I work so damn. But it's kind of like the joke's on you, Caspar. Like, you didn't want to work as hard as your father, and yet you're like probably staying up late or working all the time. But no, there came a point where I was in business school, not realizing what I wanted to do either. Is like become a lawyer, be the Wall Street bro guy. Went down that road for a year. It sucked. And you start to realize, what do you know very well, and how could you make a change with that? I knew medicine very well. I've been around doctors my whole life. I've traveled the world meeting some of the brightest minds in medicine with my father and my mother, who's a doctor as well, PhD in psychology. And I knew that field very well. And I also knew the huge opportunity that was there to change it. So for me, there was a point where after, business school, I was like, maybe I should go back to medical school. But I thought I'd make a bigger impact on the outside, not being indoctrinated as a doctor, as an outsider who saw things very differently in medicine and was able to hopefully really impact a number of doctors, not just myself as a doctor, but a number, and change the fields and the whole industry. I mean, that's what really my goal and vision is, to transform medicine. And I understand I could have done that on the ground, but I also could do it from that 30,000 foot view, that macroscopic and corporate business side of like, how do we get this done? How do I give lots of doctors the power to truly be present with their patients and heal them? And for that reason, I didn't become like a doctor. So it started off with this, like, I didn't want to work so hard. I turned out working harder. And then it turned into this, how could I still work alongside my father, who I greatly respect, but actually provide very good benefit to what he doesn't do well, which is the business side. He does it well, but he doesn't want it. No doctor should really do that. They should focus on healing. They should focus on seeing as many patients as possible, not the red tape bureaucracy that so many deal with and don't want to. And so I found it a perfect synergy. I love working alongside my father most days. And, and I get to really influence a lot of doctors without having to be one. Do I wish at times my name had an MD at the end of it? Absolutely. I mean, it's tough out there in the world of social media when it's like, what do you know? You're not a doctor. Shut up. You're selling stuff. You're just a businessman. But I'm sure I would get that critique also if I was like a doctor. You're not a conventional doctor. What do you know? Like, that's the truth of the matter. So I still feel like you could be, a keen observer and share what a lot of doctors talk about and people I really respect, and impact a lot of lives that way. You don't need an MD at the end of your name. So that's why.
Yeah. I think there's a lot of different roles in there when it comes to spreading awareness of different, medical and health options out there. And, look, you and I came across a lot of doctors over the years that were brilliant at what they do, but they had no way of getting their message and their practice out there. They needed an entrepreneur, to get that message out there. So I think, there's so many different ways that you can engage and interact with making, health more accessible to people. So I'm personally glad that you went this route.
Thank you. Although refer to me as Dr. Szulc for the rest of the interview.
Will do, Dr. Szulc. All right.